Good morning, everyone, and welcome to day 2 of Life Science Innovation Northwest. My name is Alexis Holzer, and I'm the Assistant Director for Economic Development at Washington State University. And today I get to interview one of our fellow research professors from Washington State University, Dr. Crandall, who is also the CEO of BehavioMetrics. So welcome to the program.
Thanks for having me.
Yeah, thanks for being here. So first off, just tell us a little bit about BehavioMetrics, how it came to be, and what are your main goals?
All right, BehavioMetrics is a spin-off from Washington State University. We've been involved with 8 years of research there in the area of elder care and elder care technologies, specifically using machine learning applications with clinical psychology information to put those together to really be able to help build technologies to help people live in their home well longer as they age. We've been involved with this for quite some time now, and it's time to bring it to market. The university has had 300 publications. We've had 7 patents. The research group has been very active under Diane Cook and Maureen Schmidt-Edgecombe. Out of that, I've been involved since the beginning. Our CTO, Brian Thomas, has been involved since the beginning as well. We know the ins and outs of everything, and the market is finally ready for this.
Great. So you're a computer science guy by background, and we see more and more at these life sciences conference, we're talking about data, because when you're talking about elder care, collecting information, talk about that integration and why that's so important.
The ability to deploy sensors and build up an instrumented life, the kind of the whole life monitoring we're starting to see all throughout our society is radically changing what we can know about ourselves. And the amount of information we get is very large. It tells us many, many subtle details and things about how we are, how we're living, how our health is. What we're looking for in the computer science world is it's a machine learning problem. We're saying, given this information, what can we tell about the person's health, how they're doing, what they're doing, when they're doing it. And that mapping has been the underpinnings of the research and the technology that BehavioMetrics is bringing to the market. This is something that few groups have been able to achieve, and it's where we started with that knowledge before we get to the actual sensors and technology, which is a relatively solved problem. It's that machine learning capability of mapping from the sensors and data in the home to the healthcare informatics that the residents need, their families need, and the caregivers in general need.
So can you talk about the IP, the core IP behind BehavioMetrics?
Yes, the core items that we have on hand that come out of WSU are the ability to do activity detection. What are people doing and when? Mostly cooking, eating, sleeping, and your day-to-day activities of daily living. The ability to transfer that information from one person to another, from one sensor platform to another. The ability to handle multiple people, which is a rare and difficult problem. And
when you're talking about like in a assisted living?
Assisted living, or even just a home. Multiple residents and pets are even an interesting problem for us. And so then, but another really big one that's come out just recently is the ability to map between people's behavior and their cognitive health. And so over time, in a long-term view, we can say how people are doing cognitively as they age, which is a very key point in decision-making about when they need more care and what kind of care they need.
So that's in an effort to reduce costs, but also better monitor the wellness of people as they age.
Yes. The costs of doing cognitive health measurements are very high. It's a specialized field. You have to come into the clinic and spend 3 hours going through a battery of clinical evaluation, which does a very good job, but it's expensive and time-consuming and difficult for the residents. Our system runs on a day-to-day basis, and after a short learning period can then start telling you how you're doing. That information is really what we need to be able to make those decisions.
So here at Life Science Innovation Northwest, this is your first conference as a new CEO.
Yes.
Can you talk about some of the, maybe nervousness or excitement about being a new CEO, and sort of how this conference is helping you network and expand the message of what you're trying to do with BehavioMetrics?
There's definitely both nervousness and excitement. The more I've been here, though, it started out very nervous, but the more I've been here, though, the more I realize what we have is a good product and a good approach to achieving these things. We've had great feedback from potential investors, from other technology companies, potential collaborators. And so the more I've spoken with people, the more I feel that we've got the right thing here.
Great. So you have a poster here. Do you think next year you'll come back and make a podium presentation?
I'm hoping that next year when we come back, I'll make a podium presentation of how we've been a success.
I love it.
We've brought it to market.
Great. So can you talk about how the academic world and maybe WSU in general has helped you to commercialize this?
They've actually been very, very helpful across the board. WSU itself as an organization has been very interested in bringing this to market, and we are in the right place at the right time. The people who are knowledgeable of it, of the underlying technique and capabilities of the system, and so the process of being in academia, going through the additional training, the degrees, the research, so that we have a very strong grasp has been very important. Then the universities, various departments and organizations interested in commercialization have been very supportive of this as well.
Great. And do you have grad students that are working on this as well?
Our CTO is just finishing his PhD, and
Excellent.
so yes.
Okay.
But we have grad students in general looking at mostly kind of the next generation, and something that we are very interested in. Diane Cook is an advisor, official advisor of BehavioMetrics, and we're looking at that continuous channel of new concepts, new ideas, and new results that come out of the research industry to keep fueling our next versions and features that we're going to be offering to the community at large.
Yeah, it's really important to include that next generation of
Always.
entrepreneurs and workforce in the work as it's happening.
Yes.
Board of advisors, or do you have any other industry professionals on that? What does that
Not
look
yet.
like?
We are seeking some people, most notably in the combination of healthcare and insurance, because there's a position for this kind of technology that not only can it be sold to individuals. We're going to start out primarily in the world of continuing care retirement centers, larger industry members, mostly because they have the skills and background to install this kind of technology, make more use of it. The refinements we're seeing with that is what's going to be able to take us to the private home. And that process of going to the private home is where we hit 80 to 90% of the market. Additionally, the ability to get reimbursements, to fit it into the insurance policies and the insurance structure is going to be invaluable. And so there's at least one person we're going to be looking for there.
Great. Well, I hope you find that person here at LSINW.
We've talked to several.
Awesome. Well, we're excited to see this development. This has been Aaron Crandall, who's the CEO of BehavioMetrics and a research professor at Washington State University. My name is Alexis Holzer, and I am the Assistant Director for Economic Development at WSU. And thank you for being with us on WBBA TV.
Thank you.